Hello, my name's Sarah Barley-McMullen and I'm here on behalf of Long COVID SOS. I'm going to talk very briefly about some of the key inequalities faced by people with long COVID. Access to consistent quality healthcare is one of the biggest challenges faced by people with long COVID. Many struggle to be believed, get a timely diagnosis, and access to specialist clinics is unevenly distributed. Sometimes now the clinics have even closed. All of this leads to significant gaps in care based generally on where someone lives. A more equitable healthcare system is needed for people with long COVID to ensure that everyone receives the treatment and the support they need. Long COVID often leads to employment instability, as people may be unable to work full-time or even at all. Many employers lack understanding of the chronic nature of the condition and how it can fluctuate and impact an individual differently from one day to the next. This can result in workplace discrimination and a lack of accommodation and adjustments. Without proper sick pay, job protection, or an ill health retirement option, people with long COVID can face severe financial difficulties. Obtaining disability status for long COVID remains a major challenge. Without official recognition, people struggle to access benefits and necessary adjustments. Additionally, the inconsistent application of equality law means that many are left without the legal protections they deserve, further compounding their difficulties. Living with uncertainty, fluctuating and chronic symptoms, and even the misdiagnosis of long COVID as just a mental health condition can often lead to significant mental health challenges. Anxiety, depression, and feelings of isolation are common, yet many patients report a lack of mental health services and support tailored to their needs. Better integration of mental health support into long COVID services seems essential for a holistic approach to recognition and care. Long COVID disproportionately affects marginalised groups, including ethnic minorities, people of colour, women, and people on low incomes. These groups often face pre-existing inequalities in healthcare access, also in employment and social support, which are all further amplified by long COVID. Addressing these disparities is critical for achieving true health equity. The lack of comprehensive research on long COVID, particularly in marginalised communities, has led to gaps in understanding the full scope of the condition. These groups are underrepresented in studies, making it difficult to address their specific needs. Research often fails to explore how race, gender, and socioeconomic status interact with long COVID, because research often doesn't have patients at the heart of what they're doing. All of this further deepens inequalities. Without a focus on intersectionality, of patient participation, of data gathering, we miss vital opportunities to create equitable care and support systems for everyone affected. Children and young people with long COVID often struggle to access the kind of educational support that they need. They need this support to enable them to stay in education so that their education as a whole isn't disrupted. Misunderstanding of symptoms, lack of belief, lack of recognition for children and young people within schools challenges students with long COVID, resulting in inadequate accommodations and adjustments, leaving them feeling out on their own. To address these and many, many more inequalities, there must be systemic changes across healthcare, education, employment, and social support systems. Improved access to stronger protections, better messaging, better support for children and young people, inclusive policies, and data gathering are all essential to ensure that no one with long COVID is left behind. We need better healthcare access, stronger employment protections, enhanced disability recognition, expanded mental health services, and inclusive research with patients at the heart, as well as policy development. Thank you.